back at the Naturopath from New Zealand. Thanks for coming back to our channel. We're going to talk about omega-3. In particularly, we're going to talk about various health benefits that have been attributed to omega-3. So omega-3 and fish oils, I don't think any nutrient will have been studied more the past decade than omega-3. So what I'm about to tell you, the 10 benefits, but I could be 50 benefits because there are so many benefits to omega-3. What I'm going to tell you is actually scientifically documented. I'm not pulling it out of thin air. I didn't get it out of a cereal packet box or something. This is actually scientific fact, right? And there are hundreds, if not thousands, of studies that support what I'm about to tell you. I think let's kick it off with mental health, number one. Omega-3 has really come to the forefront in the last decade, particularly for treating people with all kinds of problems, depression, anxiety, for example. And many of these pharmaceutical drugs that are given to people, instead, people should be trying omega-3 fatty acids first. There are dozens of studies that link up, for example, depression, having, people with depression having very beneficial result with omega-3. In fact, there is one study that showed that long-term use of omega-3 was better, if not equal, if not better, than using a well-known antidepressant. So instead of putting people on antidepressants, they need to be put on omega-3 first. Omega-3 has an incredible effect on the brain, both EPA and DHA. A lot of the brain tissue, the fatty tissue of the brain and the eye and the nerves, is in fact composed of molecules, of fatty acid molecules. Omega-3 is required for the nervous system, the central nervous system in particular. So researchers found that when people have high levels of fish in their diet and take omega-3 supplements, they suffer significantly less from anxiety and depression. So that's mental health. The second one is ocular health or eye health. There are several nutrients that you can take that are really beneficial for your eye health. We look at zeaxanthin and lutein, for example, different flavonoids. We can look at all sorts of amino acids, and there are also many fatty acids. Corn and spinach and egg yolks and blueberries and avocados, those 5 are really good for the eye. Corn, spinach, blueberries, avocado, also sardines, and of course anchovies, which are very high in omega-3. So DHA, one of the components of omega-3, in fact makes up for a big part of the structural component of your eye. So again, studies in the States in particular have shown that when people have got good levels of omega-3 fatty acids in their diet, they tend to suffer a lot less from age-related macular degeneration and diabetic issues with their eyes. So this is a really good supplement to take for a person, say my age, 60 plus, but any age, for eye health, all right? Eye health. The third one is pregnancy and early life. And again, there are probably well over 2,000 documented studies just in the last dozen years on this topic alone, on pregnancy and early life of infants. In fact, I think this is what really started a big part of the omega-3 craze, was when they discovered how well fish oil worked in pregnant women's bodies, but also the benefits it conferred to the unborn child. Higher intelligence, better communication and social skills, less behavioral problems, less ADHD, autism or cerebral palsy, reduced risk of developmental delay. So just children perform better, they think better, they feel better, and they act better in their formative years when they've had fish oil. When the woman takes the omega-3 capsule, if she doesn't want to eat oily fish, then takes omega-3 daily, particularly for that 9 months. It's a very, very smart thing to do for that baby. So that's pregnancy and early life, a significantly benefit from omega-3. So remember, you're forming a whole new person inside a person, so you might as well give that forming of that new person the structural components to make a superior body, and that includes omega-3. Fourth one, improves heart disease risk factors. So, and again, I've spoken with some of the top heart specialists in the world about this. Dr. Ross Walker from Australia, cardiologist, written several books, got his own TV and radio channel. Very, very favorable of taking omega-3 for cardiovascular health. It just helps so much for the heart as well. It reduces plaque buildup in the arteries. It helps to keep the blood thin by reducing clot formation. Has a beneficial effect on various clot pathways in the blood system. It reduces inflammatory eicosanoids. It reduces the low density lipoprotein, so the bad fat gets pushed down, while fish oil increases HDL, or the beneficial fat gets pushed up. Triglycerides, which are a kind of a fat, often pushed up when people eat too much sugar or sweetener diet, also gets reduced with omega-3 fatty acids. So omega-3 improves all parameters of heart health, even helps to reduce blood pressure. The fifth one is autoimmune diseases. So studies have shown that when a woman takes omega-3 supplements when she's pregnant and when she's nursing and when the baby's young, that child has got a significantly lower risk of autoimmune disease as that child gets older. And again, research validates that. We're talking lupus, Sjogren's, we're talking various types of inflammatory bowel diseases. So right across the board, autoimmunity is well supported with omega-3 fatty acids. I would probably recommend you take 2 or 3 capsules per day long term if you've got autoimmune disease. This helps significantly to reduce overall inflammation in the gut and in the body. Sixth one, asthma. And again, asthma parameters are improved significantly in young people, particularly children and young people, but also young adults. A bit different for older people. But young people have shown to have far better lung output, less wheezing, less coughing, and less issues with respiratory inflammation. So asthma has also benefited significantly with omega-3. Point 7, cancer reduction. I've read so many studies on cancer and omega-3. People who take regularly omega-3 supplements have a lower rate of cancer than people who don't take them at all. In fact, there's a 55% plus reduction in colon cancer for people who take omega-3 every day. So another reason to take omega-3. 7, age-related mental decline, cognitive dysfunction, Alzheimer's disease. These types of conditions are also benefited from people taking omega-3 regularly. Because remember, it's also great for early in life, but it's also great for people, that are more advanced. So anything to do with the brain or the nervous system, you can't go wrong with omega-3. Number 9, overall inflammation in the body is reduced. Now, inflammation is a normal response to injury, to all sorts of different situations in the body. And normally the inflammation is short-lived and then it will go away, but sometimes it's chronic and ongoing. And this is when people are taking non-steroidal anti-inflammatory drugs, ibuprofen, Tylenol, paracetamol, junk like this. And people take these things long term and they destroy the gut, they wreck the gut, they create havoc, they create so much disease and disability. But guess what? Fish oil does the same job, and yet no pharmaceutical company will ever promote fish oil. I think they're starting to talk about it now, but this is what you need to take if you've got pain. You need to take omega-3 long term, all right, for overall reduction of body inflammation. Inflammation is like a fire. It can take off on you and it can take out a whole forest really quick. And the last one is metabolic syndrome, which is really a conglomeration of like high blood pressure and poor blood sugar control and cardiac issues, bad blood fats and things like that, central obesity. So all of these things push you towards heart disease and cancer. So people with metabolic syndrome definitely benefit from omega-3. It's going to help to improve their overall blood profile. It also, omega-3, I've discovered, helps people with non-alcoholic fatty liver, NAFLD I think it's called. So people who got fatty liver benefit also from omega-3. And many people with metabolic syndrome, I spell it S-I-N, syndrome, because they've been sinning, let's face it. Been sinning with, not so good food often and not so good drink. Not all of them, but many of them. And this is particularly for the aging baby boomers. So they'll benefit from a lot from omega-3 when they've got this metabolic issue. So that's just 10 out of a list of 50 topics I can give you regarding omega-3 on how beneficial it is. So it's a ubiquitous supplement, meaning, it's everywhere. You should take it daily because it's so good for the body. And check it out, omega-3. Thanks for tuning in.